All right, so good afternoon, everybody. Just wanted to welcome you guys to a Medicare one-on-one with Alabama One and Medicare Advisors of Alabama. And I'm Eric Smith. I'm the owner and also an agent for Medicare Advisors of Alabama. And first of all, I just want to tell Tanya Winstead how much we appreciate the opportunity to teach this class. I know COVID has caused all sorts of issues over the last several months, and one is this. We wanted to do this meeting in person, but I think Zoom is a pretty good alternative. So Alabama One is so great at doing so many things for the community, and Tanya, I just wanted to tell you how much I appreciated the opportunity, and you can say a couple things and we'll get rolling.
I just want to welcome everybody. This is an open format, so as we go through, if you have questions, please ask them as we go through the slides, and thank you for joining us today.
Yeah, and so just to kind of jump in, we'll try to keep on pace here, but who is Medicare Advisors of Alabama? So let's sort of start there. So number one, we're an insurance agency. We're based out of Birmingham. We like to think of ourselves as just a group of local, kind-hearted agents that are knowledgeable about Medicare with several decades of experience just helping Alabamians with Medicare. We don't work for the government, so we are not a government program at all. We are an insurance agency, but we specialize in Medicare, and Medicare can be a little bit confusing. Healthcare in general can be a little bit confusing. And so for years, I worked for insurance companies and realized that the thing that people needed more than anything was just education. And we are licensed and appointed with all the different carriers within the state, or the majority of them. I can't say every single insurance carrier, but the vast majority of the insurance companies. Our advice is always free. Our education classes are always free. We never charge anything. We do have to make a living though. And so the way we get paid is as insurance agents. If we're able to help you get enrolled into a plan, the carrier will pay us a commission to do that, but those commissions are regulated by the government. So company X can't pay more than company Y than company Z can pay. So basically, if we're talking about Medicare products, they essentially pay the exact same amount across the board. And there's a lot of times, we'll talk a little bit about PHIP and retirement plans and things like that, where you don't necessarily need our help to get enrolled into a plan. Our advice and sort of to guide you through what to do in retirement is simply just free for us, because there's plenty of people who are going to need help. And if we can be some of assistance and help you get into the right plan, that's really what our mission is about. So without that, you guys are more than welcome to ask me questions as we go throughout the meeting. Surprisingly, it's actually really good to have the more people asking questions, the more interaction we have, the better. So you guys feel free to ask questions as we go through, and I'll try to do my best to keep us on point as we go through here. So and our website, just to let you know, our website is medicareadvice.org. That's the easiest way to find us. You can also find us on Facebook at Medicare Advisors of Alabama. Just search that in Facebook. You can do a quick Google search on Medicare Advisors of Alabama as well, to learn a little bit more about us. So let's jump into the topic of the day, which is Medicare. So when you become eligible for Medicare, everyone receives this book, the Medicare and You book. If you are already on Medicare, you get an updated version of this every fall. This is available online through a PDF. So if you wanted to get your own copy of it, you can just go to medicare.gov, and there's several different places where you can get a link to Medicare and You. This is a really good book. If you knew what you were looking for and you knew what questions to ask, this book would answer those questions. It's really thorough and it tells a lot of stuff. The problem with Medicare and You or Medicare in general is most people are just not familiar with healthcare. And so our experiences with healthcare is typically going to work and our employer tells us what our health insurance is. And we're sort of picking between a high deductible and X amount of dollars coming out of our paycheck versus low deductibles and more money coming out of our paycheck. And we show up at the doctor with an insurance card and we don't really have the knowledge of how did that insurance get developed, you know, how did these co-payments happen and how did these deductibles happen, and then all of a sudden you turn 65 and you become eligible for Medicare, and man, you are your own benefits manager. You are trying to decide which company and how to package your plan and all this kind of stuff, and it just can get overwhelming. And so the goal of today's meeting is to simply give you guys a basic understanding of Medicare, how it works, what to look at, and how to make good educated decisions. So let's just jump in a little bit to who qualifies for Medicare. So when we talk about Medicare, what we're talking about is insurance that the federal government provides. They provide it for two groups of people. So you have to be 65 or older to be eligible for Medicare, or you can be under the age of 65 but disabled. And so when you're deemed disabled, there's typically a 2-year waiting period for Medicare to begin, but sometimes that rule is a little bit different because if you get diagnosed with end-stage renal disease or ALS, your Medicare could be effective immediately, but you also have to be a U.S. resident or a citizen to be eligible for Medicare. So 65 and older is sort of the magic number, but you also can have Medicare at an early age or an earlier age if you're disabled. So to get in a little bit to what we call preparing for Medicare, let's talk about the parts. So there are 4 parts of Medicare, and they're creatively named Part A, Part B, Part C, and Part D. So people ask all the time, why are there all these different parts? Why isn't it just one thing? And if life was just one thing and it wasn't very complicated, then everything would be pretty boring. So we want to, you know, kind of get into these different parts and talk a little bit about why they exist. So the first thing that happened with Medicare is we needed hospital coverage, and that's Part A. And so Part A is when you get admitted to the hospital and you're laying in a hospital bed and you've got nursing staff and equipment and a building and food and all these different things that are happening within a hospital system, from the tests to blood to the machines. Part A is paying for all of that in a hospital. It also pays for skilled nursing, and it also pays for hospice. Part A does quite a bit, but it's usually focused around inpatient hospital care or hospice. Part B, which is a little bit different, Part B focuses on the doctor side of things, the medical side. So when you're thinking about primary care visits or specialist visits or outpatient surgery, or if you need medical equipment like you know, a wheelchair or oxygen or, you know, a back brace, those types of things are all paid under Medicare Part B. Flu shots, pneumonia shots, those type things are paid under Part B. Colonoscopies, endoscopies, all is paid under Medicare Part B. One thing that people ask me fairly regularly is, why do we have A and B? Why do we not just have one thing? And I use the example of Blue Cross Blue Shield. So we're not talking about insurance companies today, but I want to use Blue Cross Blue Shield as an example here because it's just something to think about. When health insurance first started in the United States, the doctors worked at the hospital. And so they would make house calls and they'd do the things that you know, they would typically do. And you know, they would work for the hospital, they'd come out and make house calls, and basically what happened was a company like Blue Cross was created to sort of band the community together to pay one particular rate per month to negotiate prices with the hospital. Well, that's where Blue Cross came from. Once those physicians decided, you know what, I don't want to work for the hospital, I want to start my own practice. I don't want to be employed by a hospital. So they went out and they began their own practice. Part B came into effect, or the Blue Shield side of things came into effect, because that covered the doctors who were not a part of the hospital. And so what essentially happened was you had this Blue Cross, Blue Shield, Blue Cross being the hospital side and Blue Shield being the physician side. So if you fast forward, and I'm simplifying some real complex stuff, but if you fast forward a couple of decades, when Medicare began, they sort of piggybacked off of that same idea of hospital and physicians coverage and just simply named it Part A and Part B. So just to kind of give you guys a little bit of a backstory about Part A and Part B. Where things get a little bit confusing with Medicare is when we start talking about Part C. Part C is a Medicare Advantage plan. We're going to discuss that a lot more in detail here in just a little bit. But just to sort of define it, a Medicare Advantage plan is a type of healthcare plan offered by a private company that contracts with Medicare to provide all of your Part A and Part B benefits. Most Advantage plans offer prescription drug coverage, but your Medicare services aren't paid for by original Medicare. That paragraph isn't going to make any sense right this second. We're going to get into some more conversation about that here in just a few minutes. And Part D is prescription drug coverage. It's the part of Medicare that helps you cover the cost of prescriptions. Prescription drug plans are regulated by CMS, which is the Centers for Medicare and Medicaid Services, but they're managed by private insurance companies. So Medicare is essentially a combination of both the federal government and private insurance companies. And this is where the confusion comes in, because private insurance companies are going to send you marketing material to get you to look at their plans, and then your mailbox becomes full and you see advertisements on television continuously, and then you're like, oh my gosh, I don't know what to do. So that's how we're going to sort of keep going into this conversation to help you understand not just the definitions, but how these things play together. Any questions so far? All right. So, and if you guys have a question, y'all just jump in and ask me. But let's talk about Part A just real quick. Let's talk about the cost of Medicare and how much it costs and what to expect. So Part A is typically no cost. Typically, you don't pay a premium for Part A. You have to have worked at least 10 years or be drawing Social Security or be eligible for Social Security from a spouse who's worked at least 10 years. So as you go throughout your life, you're getting some taxes taken out of your paycheck. FICA tax or payroll taxes is the portion that's paying for your Part A. We don't ever think about it, but as we're working, we're earning a premium-free Part A at age 65. If I moved to this country at age 65 and I had never worked, I never contributed to the Social Security Administration, then I would have to pay for Part A. It's happened, I've helped several people who are physicians who've moved their parents here from different countries, and they're US citizens now, but they didn't work in the United States, so therefore they have to pay a premium for Part A. And if you worked less than 30 quarters, the premium currently is $458 a month for Part A. Could be $252 per month, but the vast majority of the people in the United States don't pay a premium for Medicare Part A. But there is a premium. So if you hear somebody say that Part A is free, that's just not the case. You've earned it, and there's a zero premium to it because you've already paid for it. The part that most people are concerned about when it gets to Medicare is Part B. Part B, as in boy, is the physician's portion, as we mentioned earlier. The current premium for Part B is $144.60 per month. So that is the 2020 premium. We don't know what the 2021 premium is, but currently it's $144.60. That usually is going to come out of a Social Security check if you're drawing Social Security. However, a lot of people today are not drawing Social Security. So, I may be turning 65. I don't want Medicare until 66 and a half, or I don't want I don't want Social Security until 66 and a half, or I don't want Social Security until 70, but I want Medicare to begin at 65. All that means is that I owe $144.60 per month that I pay to the Social Security Administration. And typically you pay that in quarterly. So it's $144.60 times 3. that you just write a check and you send it to the Social Security Administration. Once you start drawing Social Security at whatever point that is, then they will take that money out per month of your Social Security check. If you are drawing Social Security before 65, so say that you started drawing Social Security at 62, then you're going to automatically get Medicare Part B sent to you at age 65, and that's going to be a scenario where you have to opt out of Medicare at that point. So if you're drawing Social Security, you're going to automatically enroll into Medicare Part B at age 65. But if you're not drawing Social Security and you want Medicare to begin at age 65, then you're going to have to sign up for it and opt in. Any questions about that? All right, so, and you guys feel free as we go through here, don't hesitate to ask questions, because you know, just unmute yourself and just jump in and say something. There's also a chat feature as well. So if you guys wanted to, you're like, hey, I don't really want to say anything, but I do have a question, you can put a chat up as well, and I'll try to monitor that and answer any chats that pop up.
Eric, I do
Yeah,
have a question.
yeah, go ahead, Tanya.
So, when you turn 65 and you're still working, there's no reason not to go ahead and do Medicare Part A, right?
Well, I don't want to say no reason at all. There are some nuances. Most of the time that's accurate. So if I turn 65 and I'd get a premium-free Part A, you know, it makes sense to go ahead and enroll into Medicare Part A. That's almost always accurate. However, if you are drawing, sorry, if you're not drawing, if you are participating, if I can get my words right, if you are participating in a health savings account. So let's just say I'm working and my job offers a high deductible plan with a health savings account that I contribute to for to reduce my taxes, right? So I'm putting money aside in a health savings account. I have a high deductible health plan, and at 65, I'm going to continue to work for several more years, and I'm contributing to my health savings account where I'm getting a tax benefit. You actually don't want Medicare Part A in that scenario, because there's some really weird tax rules that if you are contributing to a health savings account and getting tax advantages, you can't take advantage of premium-free Part A at the same time. So, you know, you want to hold off for Part A at that point until you get ready to come off of the insurance at work, and then you can apply for Medicare Part A and Part B at that point. And at whatever point in the future they start drawing Social Security, you'll automatically get Part A at that point. You can't have a Social Security check and not have Medicare Part A. Those two things are one and the same thing. So the only time you don't want Part A is if you're contributing to a health savings account.
Okay.
Eric, I have a question
Yeah.
about the Part B premium column, the income adjusted figure.
Yep.
So right now it's based on, for us, it's based on our 2018 tax returns. Does that change annually? So would I expect a change relative to 2019 tax returns, 2020, et cetera?
Yes, that's exactly right. So this chart that we have here is detailing something called an IRMA, an income related monthly adjustment amount. As your income goes up, so does your Part B premium, but it's on a 2-year look back. So for 2020, they're looking at your modified adjusted gross income for 2018. And the reason why that is because in 2020, we're filing taxes for 2019. So the government doesn't know how much money you made in 2019 until the end of the year. So the only accurate numbers that they can look at is 2018, because that's what's been filed and sealed and done. So this chart that we're looking at here, as we look down, the premium for, I'll get my little my little spotlight thing. So as we, well, I say I would. Let's see. Oh, there we go. So the Part B premium is here. 144.60 is how much the standard premium is. But as your income goes up, so if you're filing joint tax return and your income is between 174 and 218, then the premium goes up to 202, and then on from there. So if you're making $750,000 a year or above, then your premium jumps to 491.60. However, if all of a sudden, you're making, higher money. So let's just say that you're making $190,000 a year in 2018, but then you retire, and in 2019 your income is significantly different. Let's just say you're making $80,000 a year at that point as a couple, because you're no longer working and you're just living off of your Social Security check in retirement. And then you get notified that you're going to have to pay a higher premium. You can actually appeal the income adjustment to the Social Security Administration and say, look, I had a life-changing event, I've retired, and I'm no longer making that kind of money. And here's proof of that. Here's how much I was making. Here's what I'm making now. And they'll take that into consideration and potentially bump you back down to the 144.60.
Hey, Eric, how long does it take for them to make that decision?
It depends. So I've heard it take a pretty long while. So, a month or so, 5 or 6 weeks at the most. But it really just depends, because what happens is that as you apply for Medicare, the first thing that you're going to get is a letter from Social Security that says my premium's 144.60. But then a few weeks later, you're going to get a letter that says, oh, we were just joking, it's 144.60 plus the surcharge, which will bring your total to 202.40 or 289.20. In that letter, it's going to say, if you believe our numbers are incorrect, fill out this appeal form or give us a call or what have you. And I've seen some physicians who've retired, who it took a little while, but their income was so different in retirement that their premium dropped down some. But I've also worked with some lawyers and some financial planners who retired, but their investment income was such that their total modified adjusted gross income didn't change a lot. So they were no longer working, but their investments were high enough that they ended up making the same amount. So everybody's scenario is just a little bit different, but just know that you can appeal it. And one other note that I just want to make as we talk through this, so you notice how there's two different income premiums, in income adjustments. There's a Part B adjustment and there's also a Part D adjustment. So as we talk through Medicare, if you're paying a higher premium for Part B, you're also going to pay a higher premium for Part D. So even if you took a drug plan that say was, $10 a month, let's just say, but your income was $200,000 a year, it would be $10 a month plus $12.20. So just wanted to make that note. But then as the years go and your income changes, they're going to look back on 2019 income for 2021, and they're going to look at 2020 income for 2022. So as your income changes, so will the Part B premium. If you win the lottery one year and now you're worth, millions of dollars, it's going to change as well. So it goes both directions.
Hey, Eric, one quick last question. When they change do the adjustment on the Part B premium, and you've gone in and you've asked for an adjustment to be done, is it retroactive or is it only prospective?
It can be retroactive, but I don't want to say one way or the other. Social Security is a little bit, government, so it could be retroactive. It may be just moving that point on. What I would do is, I think it's based on when you file the appeal. So when you first apply for Part B and you find out that your premium is going to be higher, you need to go ahead and make that appeal at that point. As soon as you find out. I think what has happened for some people, and then I think that retroactively goes back to when your Medicare Part B starts. What happens sometimes is you don't realize that you can appeal it, or maybe you didn't realize that there was going to be an income adjustment until 6 or 7 months later, then you appeal it. Well, I'm pretty confident they're not going to go back all the way back and be like, oh yeah, we should have paid you back that money. They're going to say, oh, my bad. Yeah, you shouldn't have been paying, but we don't know how to send you a refund check. So the best rule of thumb I can give is when your Part B begins and you first get a letter from Social Security that says you're going to have an income adjustment, go ahead and do the appeal at that point. And then that should retro back to when your Part B began. Does that answer your question a little bit?
Yes, thank you.
Yeah, absolutely. So let's jump ahead to what I think is the most important thing that we can talk about today. So we've hit on a little bit of the definitions of A, B, C, and D, but let's get into this puzzle. So there's only 4 pieces to this puzzle, but this is the page that I just find the absolute most important thing that you guys can come away with today, is original Medicare versus what we're going to call Medicare Advantage plans. So if you notice on this chart here, we see 3 parts of Medicare. We see Part A, we see Part B, and we see Part D. We've left off the Part C, and there's a reason for that. We're gonna touch base on it in just a minute. But you also notice that there's 3 different boxes with plus signs here. When we're looking at original Medicare, so we're talking about going to the doctor and showing a Medicare card, that red, white, and blue card that says A and B on it. Few things to note. We've talked about the Part B premium. That's what we just went over. That's the $144.60. But what I didn't mention earlier is that Part A does pay for the hospital benefits, but there is a deductible if you get admitted to the hospital, and the deductible is currently a little over $1,400. So just to make sure we're on the same page with the definitions, a deductible means how much money I have to pay up front before the insurance picks up anything. So if I just had a Medicare card, and remember, I'm not paying a premium for Part A, and I get admitted to the hospital, that hospital admission is going to cost me $1,400, but I can be there 60 days and not have to pay anything else. So I'm admitted to the hospital and I have a deductible. Part B, which is the physician's portion, there's a smaller deductible of $198. And then what happens is after you pay that $198, the government will pay 80% of your bill. So I go see a physician, they do some exams and I get an x-ray and they do some blood work. I pay my first $198 and then the government pays 80% of whatever's left. And then from then on, I've met my deductible, and if I had a surgery, the government will pay 80% of that surgery. One of the things that happens sometimes in a hospital is that I'm admitted to the hospital, but I'll also see a physician who is not an employee of the hospital, who's a contracted physician to perform anesthesia or to perform a surgery. Sometimes that physician charge can fall under Part B. So I may be admitted to the hospital, but 2 things are happening simultaneously. Part A is paying for the hospital stay, but Part B may be paying for the surgery that I have inside the hospital. And the part that you have to pay is 20%. So as I'm showing my Medicare card, I'm paying $144 per month, which is, really good insurance if your insurance is paying 80%. But the problem is that the 20% is infinite. There's no cap to that 20%. So what you want to do is, if I'm going to use my Medicare card, I need to purchase a Medicare supplement policy, also known as a Medigap policy, to pay that 20% for me. This is not a part of Medicare. This is private insurance companies offering you an insurance policy that says, hey, if Medicare pays a claim, then the insurance policy that you've purchased will also pay the remaining amount. So if I purchased a Medicare supplement policy, it would pay my hospital deductible. It would pay this 20% for me. Usually the only thing I have to pay is the monthly premium and this $198. So I have to pay a $198 deductible. I've purchased insurance that ranges, the price of these things range all over the place. We'll call it $125 to $175 per month, give or take $1. But I'm paying an insurance company some money per month to help pick up the deductibles and pay the 20%. So if I have 2 insurance cards now, one's paying 80 and then I've got another one paying 20, then I'm left with both my insurance paying 100% of my claims. So I would go into a hospital or I would have a surgery and I would come out not owing anything because one's paying 80, one's paying 20, but I'm paying $144 per month plus whatever the cost of my supplement is. Does that make sense? Any questions about that? All right, so we'll keep going, but I wanted to make sure y'all definitely stop and ask me if you guys have, if it's not making sense. So what we've talked about is just having two cards, 80% and then 20%. What also happens when I have Medicare is that I need to get a Part D plan. So Part D is a standalone prescription drug plan. It didn't even come into an existence with Medicare until 2004, 2005, and it started officially in 2006. So Medicare's been around since the 60s. Part D didn't really start until 2006. So today, if I have original Medicare, I would be carrying three cards: a Medicare card, a supplement card, and then a standalone Part D card. I would be itemizing my insurance, purchasing three separate policies, well, two separate policies. One's from the federal government, and then one from a private insurance company to help me pay what Medicare doesn't pay, and then also a standalone drug plan. Y'all with me on all of that stuff?
Yes.
Okay, so let's move to the next section, which is really important to understand the nuance here. So a Medicare Advantage plan is on this side. So Medicare Part C is really important to understand the difference between original Medicare and a Medicare Advantage plan. So if you think about a coin, and on a coin you have heads and tails, insurance and the federal government's insurance program is no different. So you have a original option, which we're going to call heads, and then we have a Medicare Advantage side, which we're going to call tails. So on the original side, the federal government's paying your claims. On the tail side, or the Medicare Advantage side, you are bundling all of your Medicare benefits together, managed by an insurance company. So an insurance company would be paying your Medicare claims. It doesn't supplement your Medicare card. It basically is managing the whole thing. So if I took the idea of a Medicare, the traditional Medicare side, a supplement, and a drug plan, and bundled all of those things together under one roof, then I would have a Medicare Advantage plan where it's your hospital, your physicians, your prescription drugs, all bundled together under one package. Are y'all with me on that?
Yeah, I'm going to ask, though, you may not be, I may be asking too early.
No, go ahead.
The bottom of that box for Part C says $0 premium, but must continue to pay Part B. That would include the base B plus your IRMA, correct?
That's exactly right.
And then do you also pay your D IRMA?
That's exactly right. No, you are the perfect segue. So when you have a Medicare Advantage plan, the premium for most Medicare Advantage plans are zero. So in the state of Alabama, every county has a zero premium option. However, some insurance companies could charge a premium. So there are different plans that have a monthly premium. So the $144.60, you've got to pay no matter what you're doing. So you must continue to pay your Part B premium. If you are receiving an income adjustment on your, because your income is higher, that income adjustment is going to follow you along, both on the Advantage side and on the traditional Medicare side. So if you're paying an income adjustment for Part B, and say your premium, instead of it being $144.60, is, $202 per month, and your Part D adjustment is $12 per month, then that $12 per month will also carry over to the Advantage side. And just a side note on that is, if you're receiving an income adjustment, you don't pay that income adjustment to the insurance company. You still pay that to the Social Security Administration.
Say that again. The IRMA goes to Social Security?
IRMA goes to Social Security, exactly.
All right, and then you may have said this earlier, sorry, but I realize, again, we've talked about 2020 is based on 2018 tax, therefore 21 is based on 19. But does the adjustment take place sometime after April or May, once you've completed the filing process? When does
Yes.
IRMA adjust?
IRMA adjusts to It's a good question. So I'm trying to think about the time frame. I think it would adjust because if we're we're going into 2021, we'll be looking at 2019 taxes. It would adjust at the beginning of the year because we've already filed all of our 2019 taxes, usually. Right? So it should change at the beginning of the year, or at least sometime in the first quarter, you should receive some sort of notification. I don't know that 100%, but I would assume that it's got to be somewhere in the first quarter. No one's ever asked me that. I'm going on an assumption that it probably, you would have to be notified at the beginning of the year, because in 2021, they're looking at 2019, we filed 2019. And so somewhere in the fall, well, not the fall, probably somewhere at the end of the year, the first of the year, they're taking that into consideration and would send a letter accordingly.
Okay.
The main thing with an Advantage plan is you don't have to purchase a supplement and you don't have to purchase a standalone drug plan. It's all sort of just bundled together, so you don't have to purchase those extra policies. So if you choose an Advantage plan, you would only pay the $144.60 for Medicare, and you wouldn't have to pay anything in addition to that. But when you go to the doctor, the difference is you would pay co-payments as you go throughout the year. So for example, if you go into your primary care doctor, you may pay, $5 or $10. Or if you go to a specialist, you may pay $30 or $40 for a specialist. If you had an outpatient surgery, you may pay, $200 for an outpatient surgery. So it just depends on which plan that you have and what those benefits are. But you definitely do have co-payments. There is an out-of-pocket maximum that those co-payments can't exceed. So you want to ask that question as well. But the most important question that you can ask about a Medicare Advantage plan is, do my doctors accept your insurance plan? So if I'm going to choose my insurance through an insurance company, and I want to have everything bundled together, I really want to make sure that the doctor that I'm going to go see is going to accept that insurance plan. That's true for your insurance today. It's true for all insurances, that you want to make sure your doctor can bill that insurance company. Before you ever sign up for an Advantage plan, you want to say, you never want to ask the question, I want to choose my own doctors. You can always choose your own doctors. The answer to that is, of course you can. The question that you should ask is, are the doctors that I have chosen in your network? So as long as they're in the network, you should be fine, but you want to make sure that's the case. And there's companies that have smaller networks, and then there's companies that have much broader networks, and they each have their benefits, and you just want to make sure that the plan that you're picking, your physician accepts. And they're really, a lot of doctors take Advantage plans now. And there's a lot of an advantage to an Advantage plan because they also a lot of times throw in dental benefits or some vision benefits, where traditional Medicare doesn't have those added benefits. So it's just a little bit of a lesser cost per month, but paying co-payments as you go throughout the year.
Are there deductibles associated with Advantage?
Usually no deductibles. They could technically have deductibles, but I've never seen a Medicare Advantage plan with a big deductible. It's usually just co-payments and an out-of-pocket maximum. So it's, people have asked me a lot, like, well, Medicare Advantage plan seems like it's, a lot less expensive than the traditional Medicare route. Why doesn't everybody just choose that? And everyone's in different scenarios. You just can't paint a broad brush and say everybody needs this plan. That's why we have choice, because, and ironically, it used to be called Medicare Plus Choice. That was its original name. But then as Part D was created, they sort of just renamed it to Medicare Advantage because what's interesting about it is the federal government's program, which is Medicare, gives you two options, which is a public option, which is the original Medicare, versus a private option. They're both Medicare. It's just a matter of who's managing it. So a little bit of a nuance is an insurance company that's managing your Medicare benefits still has to follow all guidelines that the government is setting. So for example, if Medicare says we're now covering X procedure, Well, then an Medicare Advantage plan also has to cover that procedure. You know, they can't deny a procedure that Medicare would have covered, you know, because it is still a Medicare plan. I worked for an insurance company that one time said, well, we don't cover that procedure. You know, one of my clients was getting a procedure and they called me and they said, you know, they told me that I couldn't get that procedure. And I looked it up on Medicare.gov and it says, yes, it's new. It just got approved. And I was sort of able to print out the law and the rule that said, hey, look, it is covered now. And they were like, oh, well, I guess we do have to cover it. Now we have to figure out what the copayment is, you know, and it was an outpatient surgery procedure. So, and it paid like anything else. The only difference is that for Advantage plans or insurance plans, they could say, well, before we do that procedure, you need to take this, you know, nutrition class or whatever the case is. So an Advantage plan could put some sort of stipulation on the procedure that you need, you know, I don't know, physical therapy before you have that back surgery. But if you've already had physical therapy, your doctor says, already done physical therapy, now we need the back surgery. So it's just like any insurance company that you've had your whole life. It's just a Medicare plan through an insurance company. Is that helping you guys? Is that making some sense?
So what are some of the things that Medicare does not cover?
So Medicare would not cover, Medicare covers almost everything. So just to kind of, you know, help you a little bit there, it wouldn't cover things like plastic surgery if it was for like, well, I'll give you a perfect example. So like, well, let me follow with plastic surgery. So if my nose was crooked and I wanted to get my nose fixed, it's not going to pay for that. Medicare doesn't pay for dental procedures. So if I needed a tooth extracted or I needed, you know, an implant or false teeth, or I needed, you know, something as simple as teeth cleaning, Medicare doesn't pay for those things. It doesn't give you, you know, benefits on, you know, eyeglasses unless you've had a cataract surgery. So when we think about Medicare, think about it as a medical claim. So when we talk about teeth, if you have a tooth that's abscessed and causes an infection, well, now an infection becomes a medical claim because that could impact other parts of your body, then that is a Medicare claim and it will pay to get rid of that abscessed tooth and it will pay to, you know, fix that infection, but it won't pay to put in a new tooth. You know, that's more cosmetic. So you'd have to have separate dental insurance for that.
Hey, Eric.
Yeah.
I used an example this morning that came up with custodial home health care. They needed somebody to come in and help with their bathing and dressing and stuff, but it was not medically necessary. And they thought that Medicare would pay for it, but it was just what they call custodial home health.
No, that's exact. So yeah,
would,
no, great point, Paige. So you have, you know, home health versus home care. So in a past life, I managed a home care company, and home health is, you know, it could be physical therapy in the home. It could be a nurse that comes out after you've been discharged from a hospital to take care of a wound, those kind of things. But if home care is like, I need somebody to come in and care for my home because I can't take care of the home and myself. So I need somebody to do light housework, you know, help me with the dishes, you know, maybe clean up a little bit, help me move from room to room. Medicare does not pay for that. That's something that somebody typically has to pay out of pocket. Oh, and by the way, guys, I meant to say this earlier. Paige Phillips is on the call. Paige is a good friend of mine, and she's an agent that works with Medicare Advisors of Alabama. So if y'all wanted to meet with somebody individually or just talk with somebody on the phone, Paige will give you her phone number at the end as well, and you guys can call her or call me directly. Either way, it doesn't really matter. She knows a ton, and you know, if I don't know the answer, I'll call her, and if she doesn't know the answer, she can call me. So but that's a really, home care is a perfect example. So people get that mixed up. And one thing that Medicare doesn't pay, just while we're talking about that, is Medicare doesn't pay for you to move into a nursing facility. Sometimes people think that, you know, if I need to put my mom into a nursing home, that Medicare pays for that, or there's some sort of mechanism to pay for that. There really isn't. Medicare itself does not pay for moving into a facility. It does pay for rehab. So if I've been in the hospital and I've had a stroke and I need to go into a skilled facility for rehab, the Medicare definitely will pay for rehab, and you can get up to 100 days in rehab, depending on your condition, but it doesn't pay to move in. That's where Medicaid comes into play. So that is something to remember just as we go through here. So, but other than those things, Medicare pays for quite a bit. There's very few procedures that Medicare doesn't cover. So therefore, the Advantage plan would also cover. Did that help answer that question?
Yes.
Perfect. Anything else you guys want to talk about on this page before we move on to any other topic as we sort of go through this? All right, so for some, oh wait, it's working. Oh, I was going to say my mouse quit working all of a sudden, but now it's working. So I think the more I use the drawing tools, the more my mouse just acts crazy. So I'm glad that it's back up and running. So when can I enroll into Medicare? So let's talk about a couple of things. So initial election period, IEP, is your first start date for Medicare. So there's a 7-month period that begins 3 months before your birth month, and then the month that you turn 65, and then 3 months after you turn 65. So Medicare typically begins at 65. You have a 7-month window to enroll into Medicare. 3 months before, the month of, and 3 months after. Something that has come up to me a couple of times in the past few months is when people have read that you can enroll into Medicare 3 months before you turn 65, they think that Medicare will begin 3 months before you turn 65. And so what has happened is people have sort of planned a retirement 3 months before their 65th birthday, and they are leaving their job 3 months before 65 and all of a sudden out of insurance for 3 months because they can enroll 3 months before, but it will not begin until the first day of your birth month. It won't begin on your birthday, it begins the first day of your birth month. If your birthday happens to fall on the 1st, so if your birthday is October the 1st, then your Medicare would begin September the 1st. So you get a free month if you're born on the 1st of a month. Well, it's not a free month, you're going to pay it, but you get an extra month. You don't have to wait until October 1st. It begins on September 1st. But that's the IEP, your initial election period. And then there are special enrollment periods as well. So if you didn't sign up for Medicare A or B at your 65th birth month, but you continue to work, then you can come off of that group insurance whenever you get ready to retire and have a special enrollment period at that point to enroll into Medicare. You don't have to enroll at age 65 as long as you have active group insurance. I'm actively working. I'm not working, but I'm covered under my spouse's insurance, then I want to maintain that insurance until 70 years old, and now I want to retire. You won't be penalized for not having Medicare as long as your insurance at work is, as good or better than Medicare. Credible coverage is what it's called, which most plans have credible coverage now. And you can show proof that you were covered under your spouse's insurance or your insurance as an active employee. So what that basically means is there's 2 forms. There's a form that says, I want Medicare Part B, and here's the month I want it. And then there's a second form that says, here's proof of my insurance from my employer, and my employer has filled out a portion of this form and submitted it. So there's 2 forms that you turn into the Social Security Administration that says, I want Medicare, and here's when I want it, and here's proof of coverage. If you happen to have multiple jobs during, from 65 to 70, you would need proof of insurance from each of those employers. So you would just need a form from each of the HR departments from those employers. So if you are 65 and you're planning to work and you may change jobs a couple of times, just remember you may want to go ahead and have one of those forms completed when you leave one job to the other, and just save it as a PDF in your computer somewhere, so when you get ready to actually enroll into Medicare, you have it. Just a note.
Eric, can I ask you a really in the weeds question?
Sure.
And then unfortunately, I'm going to have to drop off for yet another Zoom at 3 o'clock.
Yeah, yeah, no worries.
So the initial enrollment period, and I'm looking at one of the tables from Medicare. Birthday is this Monday, September 14th. Okay. And have at this point rejected Part B.
Okay.
This is spouse because she's covered under my employer plan.
Mhm.
Right. But it says if you enroll 1 month after you reach age 65, then your coverage starts 2 months after the month of enrollment.
Right.
I want to get in the weeds. Birthday is September 14th. Okay. 1 month after you reach, does that mean the month of October, or does that mean 30 days after September 15th?
That's a hard one. I have to look at that chart because I know exactly what chart you're looking at. It always starts on the first of the month. So it would start November the 1st.
Well, it says 2 months after the month of enrollment. So if your birthday's in September, you're enrolling in October, and it's then 2 months after the month of enrollment. That's December.
It would start December. Yes. Yep. I had to think that through. Yes,
So
it would start
question
December.
is, do I have the full 30-day spectrum in October to make that enrollment, or do I have to wait 30 days?
No, you have the month of October to do it. As long as you make that enrollment in October, it will begin 2 months after. That's exactly right.
Okay, but the 2 months after, then it would be December 1st.
That's exactly right. Yep. So if it's September, you have October, November, and December to enroll. So if you enrolled December the 31st, it would start February 1st.
Okay, alternatively, if I enrolled October 30th, it begins December 1st.
Correct. Exactly. And one thing, and I know you've got to hop off, but I'll touch base real quick. You had asked the PHIP question earlier, right?
Yes. Yeah.
Yeah. So just to make a note of it, let me go back just to this part right here. So PHIP is just health insurance that the public educators have. When you're an active employee and you're still working, or you've retired from PHIP and not Medicare eligible, you would still just have the Blue Cross policy that you currently do. But what happens with PHIP is once you hit 65 and you become Medicare eligible, you do need to have A and B if you don't have a spouse actively working. So your wife, for example, if you're actively still working and you're covered under PHIP, then your spouse can stay under your group insurance through Blue Cross without having to enroll into Medicare.
Yeah,
but if you retired,
I'm gonna
it's
follow
different.
up with you specifically because I got
Yeah,
a real.
go for it. Go for it. We'll talk later, but I definitely wanted to mention it.
Thank you, and I appreciate the patience of everyone else while I got to ask a lot of questions. Thank you, guys.
Yeah, no worries. We appreciate you. All right, so now somebody has to take up his slack, and y'all have to ask questions now. So far, so good. I think we're having a really good meeting, or at least I'm enjoying my self-talk. And we've had very few technical glitches, so I'm happy about that. We've talked about special enrollment periods. There's other enrollment periods that are really important as well. So annual election period is the time of the year between October the 15th and December 7th that you can make changes. This is coming up. So you're going to see tons of advertisements on television and on in your mailbox and everything else about AEP. That is the time that you can change from Advantage plans, you can change drug plans, you can go backwards and forwards. There's a whole bunch of different things that you can do during AEP, and that's why you see so many advertisements. There's another enrollment period called OEP. So let's just say that you pick an Advantage plan, you get into February, and you realize, oh shoot, my specialist that I want to go see to have that knee surgery doesn't accept my Medicare Advantage plan that I just picked. And I didn't realize that my specialist wasn't in network because I forgot to ask. You have what's called a Medicare Advantage open enrollment period between January and March 31st that you can still make a change and switch Advantage plans or go back to traditional Medicare. So there's a lot of options once you get into Medicare that you're just not locked into one plan for the rest of your life. So there is some flexibility each year. You just have to make sure that you do it at the right time frame. And then Part D, I'm going to try not to spend a whole lot of time on this section here, but Part D, the drug portion, whether it's in an Advantage plan or whether it's a standalone drug plan, there are different phases of prescription drug coverage. There's a deductible phase with the drug portion where depending on which plan you have, there may not be a deductible, but it could be as high as $435. Once you meet that deductible, whether it's 0 or 435, you would go into the next phase where you're paying co-payments or percentages for your prescription. So let's just say your plan didn't have a deductible for generics, and let's just say your drug plan costs $20 per month, and you took a drug like amlodipine. You may only pay $2 a month for that drug. So it's pretty inexpensive. You know, it's a generic. I pay $20 a month. Amlodipine costs me $2. All's good. But if for some reason, you know, I'm paying, you know, I've got a lot of name brand drugs that are really expensive, you may fall into something called the coverage gap, or what's commonly referred to as the donut hole, where you may have to pay 25% of the cost of your medications if your total cost of prescriptions reaches $4,000. This is a little bit more nuanced conversation that I don't want to really blow your minds too much about. When you guys get ready to enroll into a Medicare plan, we'll definitely drill this down, especially if you have some expensive medications that could potentially get you into this gap. We'd want you to understand how it works. Just know that it's not as difficult today as it was, you know, 6 or 7 years ago. It's just a little bit different in the way that Medicare drug coverage works than what you're used to with an employer's plan. But if you guys have a specific question, you know, I can probably answer it related to drug coverage. Some other couple things I wanted to mention just real briefly. Low-income subsidies. When we're talking about drug coverage, some people, you know, we talked earlier about higher income people having to pay an income adjustment or an IRMA. Other people who have low income can qualify for extra help, or what's called subsidies. If my income as an individual person is less than $1,600 per month, I may qualify for financial assistance to help pay for my prescriptions. That's a really big benefit for people, and a lot of folks don't know to apply for that, and that's something that both Paige and I and other agents with Medicare Advisors of Alabama can help people qualify for. And then there's another program called the Medicare Savings Program. It's commonly referred to as QMB or SlimB or QI1. Those programs, you know, specifically are to help you pay for the premium of Medicare. So Medicaid, which is the state agency that helps people who have very limited income, if my income is less than $1,500 a month, I may qualify for the state of Alabama, the Medicaid agency, to pay my Medicare cost, which is at $144 per month. And in some cases, if my income is less than $1,000 per month, they may even pay the 20% that Medicare doesn't pay. And that's where people get confused with Medicaid. If you think about Medicare as being the health insurance, the care side of it, and the aid, the Medicaid side, being aid and assistance to help pay for it. That's how those two things go hand in hand. So people ask me all the time, you know, well, how does somebody who makes $900 a month, you know, pay for the health insurance? If somebody's income is that low, they're going to qualify for both Medicare and Medicaid. They're not going to pay anything ever at a doctor's or a doctor's office or a hospital, and their prescriptions are going to be $1 or $2, you know, 5% at the most when it comes to your prescriptions, because your income is very limited. They just have to know where to go to qualify for that assistance, and we can help with that. But you can also, just as a side note, there are organizations in the state outside of ours that that can help. If you just called 1-800-AGE-LINE, AGELINE, that's a state program that can also help people qualify for financial assistance, and they'll direct you to your local resource. So This next chart, just a couple more charts, we're not going to get too deep into this. This is different types of Medicare supplement policies. When we were talking about original Medicare and we're talking about different supplements, Plan G that you see here, G as in goat, is the most common type of supplement. And that's sort of what I was alluding to when we were talking about supplements earlier. We were paying a monthly premium and a supplement's picking up what Medicare doesn't pay. A version of a supplement called a Plan G is usually ideal for most people. And then different types of Advantage plans. You have HMOs and PPOs, and then you have things called Special Needs Plan, which are based usually on income or specific conditions. But when you're looking at insurance companies managing your Medicare benefits, there are different types of Advantage plans that are also available. And then just to simplify Medicare Advantage plans, like we were talking about earlier, it takes your Part A, your Part B, and your Part D and combines it all into one card, where it's your hospital, physician, and drug coverage covered all in one particular policy. And then this last couple of pages, this is the mailbox of an actual person who became eligible for Medicare. So one of my friends took this picture of somebody's mail. You know, they came in their office and dropped a Walmart sack of mail, and they just said, how am I supposed to figure this stuff out? And that's the way most people feel about Medicare, is how are you supposed to figure this out? Like, I'm looking at this and I see letters from probably 6 or 7 different insurance companies and probably 20 different, you know, organizations and agencies is trying to get you to look at different things. And to me, it's just a matter of understanding what you're looking at and then just knowing how to compare plans. So, and that's me. I probably can dress up a little bit better on certain days, but that was as good as I was getting that day, I think. So, but thank you guys so much for listening to this, you know, presentation about Medicare. I hope it's been really helpful. Y'all feel free, and we'll just kind of open it up for discussion as well. So if you guys wanted to ask any questions that, you know, we haven't had a chance to go over, feel free to just to unmute your phone and feel free to jump in and ask any questions if you want.
Eric, I had a question. In the earlier session, you said something about a date of October the 15th to December the 7th. What was those dates again?
Yeah, so
Alabama residents?
Yeah, so if you have every year, AEP, the annual election period is October the 15th to December 7th. That is the time of the year that everybody can make changes to your insurance. So one thing that I made a note on, or that we had talked about in the earlier session, let me go back to this page just real quickly. That's something important to understand. On this page here, when we're talking about traditional Medicare versus an Advantage plan, somebody had asked about, can you go from an Advantage plan back to traditional Medicare? And the answer to that is yes, you definitely can. What I was sort of alluding to in our earlier session is Medicare supplement policies, these things in the middle on the left-hand side, are not a part of Medicare. So these insurance policies can ask you underwriting questions. They can ask whether or not you've been hospitalized or what have you. So as you get older, you may have X number of conditions, and when I try to leave an Advantage plan to go back to traditional Medicare, a supplement policy can ask me health-related questions. However, if you live in the state of Alabama and you're an Alabama resident, some insurance companies don't ask underwriting questions. One is Blue Cross and Blue Shield of Alabama. So, and this meeting is not in any way to endorse an insurance company or to even discuss an insurance company, but wanted to make a point because Alabama is a little bit unique. If I'm looking at this or I'm talking to someone who doesn't live in Alabama and doesn't understand the market here, they'll tell you that you can't go from an Advantage plan back to traditional Medicare and buy a supplement if you're older, because they're going to ask you medical questions and you may not qualify for it. That is not true in Alabama. Blue Cross of Alabama has a supplement that does not ask any medical related questions. So you could be, 95 years old and have, 20 conditions and still enroll during the fall into Original Medicare and choose Blue Cross's supplement, and they're not going to ask you any medical related questions. That's not to say that their supplement is what you should do. You may be healthy as a horse and pass any underwriting, but it's just something to note that there is a lot of opportunities and a lot of advantages to moving back and forth between traditional Medicare and Advantage plan in Alabama, because the largest insurer in the state doesn't ask medical related questions. And that's an important note, just to remember, that you may not read that if you're just Googling this information. Or talk to somebody who doesn't live in Alabama and doesn't really understand that nuance. If you talk to somebody at Blue Cross, they would tell you that, but other folks, probably wouldn't know that.
So you're saying in Alabama, each year you have an opportunity to bounce from plan to plan?
So federally, all 50 states, you can change plans. What I was saying is, if I am a resident of Wisconsin, let's just say, and I have an Advantage plan, and it's November the 10th, and I'm going to use AEP to change from an Advantage plan back to traditional Medicare, and I want to buy a supplement policy to pick up what Medicare doesn't pay, that supplement policy may ask me, when's the last time you've been hospitalized? Do you have diabetes? Do you have a back condition? And if I answer yes to those questions, they may say, sorry, we're not going to insure you.
Okay.
Where in Alabama, if we did a Blue Cross policy, they're not going to ask you that question. They're going to simply say, okay, are you a resident of Alabama? Yes. Okay, this will start January 1st. So there's just a little, so the reason I wanted to mention that is there's just more flexibility here. There's a lot of, Alabama's, there's a lot of things we don't do well, and there's some things that we do really well. I've lived here, my whole life, and there's goods and bads to all insurance companies. But the one benefit of Blue Cross of Alabama being here is, as big as they are, and as much as they do in the state, they're unique, and they don't offer, they don't have underwriting. And that's a unique thing, because if you Googled Medicare supplements and did research on it, and you looked at the other companies that offer Medicare supplements, you'll hear that, they don't, they may have underwriting, or they may ask you health related questions as you get older. And that's just not the case. Being in Alabama with Alabama resident and having Blue Cross's, supplement available. So it's just a unique perspective of living here that people just sometimes don't think about. So yeah, if you guys don't have any other questions, I'm glad that everybody attended, and thought we had a pretty good meeting. Tanya, do you have anything else you want to add or discuss, or things that we wanted to kind of go back through?
No, I just wanted to let everybody know that we will be putting this on our YouTube channel, Alabama One. So if you want to go back and view it, you can. And it will be on social media. We should have it up by tomorrow.
Good deal. Well, thank you so very much. And we really appreciate you listening, and hope you guys learned a great deal. And I think we had some good feedback, and let you guys get off here. We didn't go too far over. We're 3:15, so we're just a couple of minutes over 3. So not too shabby. So thank you guys so much for attending, and feel free to give us a call. If y'all have any additional questions and want to meet individually, we can do a Zoom meeting individually if you guys want that, or just have a phone conversation. But we can also meet in person, but we'll try to stay as socially distanced as possible and wear masks and all that kind of stuff. So just tell folks about us. And Tanya, I can't thank you guys enough for letting us be a part of this, and hope to continue to help educate the folks whenever you guys want us to.
We're happy to. So thank you.
You're so welcome. Thank y'all so much. Talk to you soon.
Bye-bye.